talking about mental health and decriminalizing suicide. Did you know that suicide is a crime in no fewer than 20 countries? Yet this has not succeeded in removing it. According to recent findings, there are doubts as to whether legal or religious sanctions can serve to prevent suicide. While moral and religious objections to suicide may reduce suicidal behavior, legal sanctions hardly have any discernible effect. For instance, in the UK, suicide rates did not increase after it was decriminalized.
In Africa, and of course focusing on Nigeria, the legal position is that suicide is not a crime, but attempted suicide is. Section 327 of the Criminal Code, which applies to southern Nigeria, states that, and of course similarly Section 231 of the Penal Code applicable to northern Nigeria asserts that whoever attempts to commit suicide and does an act towards the commission of such offense shall be punished with imprisonment for a term which may extend to 1 year with a fine or with both. Now, many other criminal codes in Africa will get you asking if this, in any way has helped reduce the rate of suicide.
Now, joining us to discuss this further is one of Nigeria's top psychiatrists who is coordinating Lifeline International's campaign to decriminalize suicide in 11 African countries where it remains a crime, including Nigeria. He also sits on Africa's CDC's Advisory Board for Mental Health, so he has a continental perspective on this conversation. Welcome, Professor Taiwo Lateef Sheikh. Good morning, and thank you very much for joining us, Professor.
Good morning, Nigerians. Thank you for inviting me here.
All right. Professor Sheikh, you work closely with the Federal Ministry of Health and Nigerian parliamentarians on suicide and mental health more broadly. What has been the drive for helping victims or creating awareness towards our collective mental well-being as people?
Well, I think compared to many other African countries, Nigeria has made very significant drive towards access to mental health and prevention of suicide. Recently, the Federal Ministry of Health led the development and finalization of National Suicide Prevention Framework. And as I'm talking to you now, Nigeria has also finalized a new national mental health policy, which also hinges on access to affordable, effective, culturally tuned mental health services to all Nigerians, anywhere, everywhere, regardless of your social status or religion or ethnicity. So Nigeria has actually made very significant drive towards making mental health available in terms of policy. Now is how to implement those policies, and suicide prevention is central to the mental health policy and to the national suicide suicide prevention strategic framework for the country.
All right. I want to also ask, because it's hard to understand the mindset behind criminalizing suicide. So can you help us understand where that came from? Was it just easier to criminalize it because it might be more difficult to figure out ways to help these people who had gotten to that stage in life? The government can't provide adequate mental health, can't solve issues across the country. So let's just criminalize it, instead. And has that worked in any way as a deterrent, to the suicide rates across the country?
Okay, there are three questions you have asked me in one now. But let me start by saying that those who try to die by suicide actually don't want to die. They want to end their suffering. They're looking for a way out of their pain, and they can't think of any other way. Something has changed in their brain, and that is why they are caged. So it's not normal for someone to try to take his or her own life. The second thing is the law that criminalizes suicide is not an indigenous law to Nigeria. It's a law that we inherited from the colonial masters. The way we inherited the Lunacy Act, which was a law that manages mental health situation in the country, which we inherited from our colonial masters as far back as 1959, but was actually developed in 1916. We were able to do away with that law when the former president signed the new National Mental Health Act bill into an act on the 29th of December 2022. So we also need to do away with this very strange colonially oriented law, which we inherited from our colonial masters. That law is not compassionate. That law is very cruel. And that law does not conform with the culture of we Nigerians and Africans in general. We are very compassionate people. I'm sure in your community, if you see someone who wants to kill himself, you will not push the person to the river. Neither will you cut the person's leg. You will rather go around the person and try in a very caring and compassionate manner to find out what is wrong with you. Why do you want to die? It's not good for you to die. What can we do for you? That is what we do as Nigerians. That is what our culture permits. I must say here that, yes, our culture aborts suicide. We don't want suicide. We treat suicide badly, we stigmatize suicide. But we don't have any law within our culture that says that we should punish people who try to die by suicide. Rather, within our cultural settings, we have system that supports people who try to die by suicide. So that law is strange. It's not Nigerian. It's not African. We need to remove that law. That law, again, the third thing I want to say is that the law in itself cannot stop the thoughts of wanting to die. The law can try to stop the act, but the act does not come de novo. The act comes after the thoughts, and the thought is an abnormal thought. So the law does not go to people's mind. The law deals with people outside. So what the law does is to prevent people who have those thoughts from expressing their thoughts. So the law has become a huge barrier to help seeking for people who have the thoughts to want to die by suicide. It only prevents them from coming out to seek help because of the fear of recrimination by the law. So people will not take services that are provided to prevent suicide. So in a nutshell, these are the three answers to the three questions that you have asked me. It's a strange law. It is an affront to our culture. And that means we need to remove it. Suicide Act, people who try to die by suicide are not really feeling well. They don't want to die. They need help. They want to end their suffering. They want to end their pain. And then finally, that law is a barrier to help seeking, not only to people who try to die by suicide, but even those who try to help them. It's a misdemeanor that if you are aware that someone tries to die by suicide and you don't report it to the police, to the law enforcement agency, you are liable to 1 month in jail. So those who even try to help someone who tried to die by suicide are also liable to 1 month in jail. Compassion of that law. We need to do away with that law.
So,
thank you.
Professor Sheikh, I mean, you've really explored and expanded this conversation, and it's very heartbreaking to see that we still have laws like this that, quite frankly, do not make sense. Because like you said, these people are unwell and they're in need of help. And one of what this has done is it's also pushed back on the progress that those who seek therapy might be open to having. So let's talk about how we can go forward from here. What do we need to do? What roles do we need to play as individuals, as a society, as lawmakers? What are the various roles we have to play to be able to help us not just do away with this law, but make positive strides in the fight against suicide?
Yes, expunging the law is one step, but it is not a total solution to suicide prevention in Nigeria. The responsibility of suicide prevention falls on every one of us who have individual, community, and national responsibilities. What we are doing here today, we are creating awareness for individuals to understand what suicide is all about, what are the triggers, and why we should expunge that law. We are creating advocacy for the community and for the people who are responsible for development of policies and implementation of policies in Nigeria, for our lawmakers and law enforcement agents to understand that suicide and attempted suicide is not a normal thing, and it doesn't tally with our laws. So this is first step: awareness and advocacy campaign to sensitize people, to make people, to create understanding, better understanding among people on what suicide is all about. The second thing is to develop a coherent, leadership structure for policy change and legislative changes in the country. The Federal Ministry of Health is spearheading that. They are developing policies that should address suicide and prevent suicide in this country. And we have two of them, the National Policy for Mental Health. And the reason why I'm mentioning National Policy for Mental Health is that there is a link between suicide and mental health. 90% of deaths reported as a result of suicide are linked to mental health and substance use disorders. And within this 90% of cases that we're talking about, 70% of them have condition that is attributable to depression, depressive disorder. So there is a link, a serious link between your mental health and suicide. Secondly, the reason why government need to look into it is that studies have shown that the rate of suicide in Nigeria and low-income countries in the world has reached a crisis point. Our average suicide rate in Africa is above the average suicide rate globally. And the people that are really at greatest risk are the youth and men. And youth and men are the productive segments of the country. And that's why we have to develop policies and frameworks that will prevent suicide. And then we need to also develop resources. And that is also contained within the strategic framework and the policies. How we develop resources, mental health practitioners, institutions, how to train people who are not mental health experts, even peers, people with lived experience can also lead this campaign for suicide prevention in Nigeria. And to be able to integrate mental health into comprehensive healthcare package, including suicide, for across the layers of healthcare delivery in this country, to integrate suicide prevention into all our social and educational activities, including schools. We're talking about youth between 15 and 29 years old.
Yes.
So schools, public schools, institutions, include it into workplace health programs, marketplace health programs, people who are writers, who are journalists, news media. We need to integrate suicide prevention at all levels of our activities in this country, including religious segments, our traditional rulers. We need to come to terms that this thing is threatening our collective existence.
I think that it's very important, the angle that you've mentioned, because we do have pushbacks when it comes to conversations like this, and a lot of them are religious and cultural. But we can't exhaust this conversation. Professor Taiwo Lateef Sheikh, we do hope that we can invite you again and we can be able to dig even deeper as to the role that religion and culture has to play and how we can break free from this. But we thank you so much for your time with us this morning.
Thank you very much. I'm very grateful. Thank you.